Ladies and gentlemen, I'd like to welcome you to today's presentation sponsored by the Society of Decision Professionals, which is the Best of DAC 2019 presentation entitled, How Sure Are You? A discussion with Professor Stephen Goodman on the epistemology of clinical research and DA.
Talking on this a subject of how sure are you, the epistemology of clinical research and a decision analysis. In some ways the question how sure are you shouldn't be that difficult, but as you will see very quickly in the clinical research space, it is. So actually, I'm going to start right off with a question for the audience. And this is how I'm going to start. You should see on your screens an actual abstract of a paper that was published. And as you see, it's entitled Randomized Controlled Trial of the Effects of Denosumab on Outcomes in Patients Admitted to the Coronary Care Unit. So the goal of the study was to look at an intervention with this chemical that's been administered to patients in a randomized trial in a coronary care unit. And as you can see, looking at the structure of the abstract, it's a randomized double-blind prospective parallel group trial. 990 patients are participating in this trial, and they're randomized roughly 50-50 to get this new entity, denosumab. And in the results, you can see that compared to the usual care group, the ones who got this intervention had lower. It's a CCU course score, which is basically intensity of care score. So it indicates that they had a somewhat easier course. It said lengths of CCU and hospital stay are no different. The conclusion is that denosumab was associated with a lower CCU course score and suggests that the therapy may be an effective adjunct to standard medical care. So I'd like you to look at this just for a few seconds, 5 to 10 seconds, and think that if you read this, knowing nothing more about this intervention or this chemical, this drug that's being administered, what would be your confidence that this would improve CCU course score? So just think of it, and I'm going to trust you that you're going to be honest about this to yourself. Think on a scale of 1 to 100, how sure you would be that this might work. And I will tell you that this is the first trial of this entity. So